I now have the pleasure of officially introducing to you our keynote speaker, John Crowley. His impressive biography is detailed in the LSINW Pocket Guide, but I'd like to highlight just a few elements. As you may have gleaned from the video, John's involvement with biotechnology stems from 1998 diagnosis of 2 of his children with Pompe disease, a severe and often fatal neuromuscular disorder. In his drive to find a cure for them, he left his position with Bristol-Myers Squibb and became an entrepreneur and a co-founder, president and CEO of Novazyme Pharmaceuticals, a biotech startup conducting research on new experimental treatment for Pompe disease, which he credits as ultimately saving his children's lives. He graduated with a BS in Foreign Services from Georgetown University, received a JD from the University of Notre Dame Law School, as well as an MBA from Harvard. Please join me in welcoming to the podium John Crowley, Chairman and CEO of Amicus Therapeutics.
Thank you for the introduction, and good morning, everybody. It's nice to be here in Seattle on a bright, early Thursday morning. And having made the trip from New Jersey last night, it is a particular pleasure to spend a little bit of time in the state of Washington today. I'd like to share with you this morning what are both personal and professional perspectives on this very unique industry that we are all a part of in biotechnology. One that I came into more by an accident of fate and genetics than by any particular plan. Before I do that, let me begin by answering 2 questions I typically get when I have a chance to go out and talk to audiences, especially audiences in our industry. The first is, how did a movie come to be made about our family's journey? And secondly, how are the kids today? So Megan and Patrick were diagnosed here on the West Coast, and then again confirmed on the East Coast at Duke in 1998. Megan was 15 months old, Patrick was only 7 days old when we received Megan's diagnosis. We went through all the shock, the grief, the denial, and then eventually just wanted to do something to change the course of that prognosis. Where we were told the kids would only live to be 2. In a short while, I'm going to ask to play another brief video clip that will take you from Hollywood to the real life Megan and Patrick and their story. But as we fought to start a small biotech company, to develop a medicine, eventually developing it within Genzyme, we fought to get the medicine to many kids, including our own. And finally, in January 2003, almost 5 years after their diagnosis, and about as long as they were ever supposed to live, they started to receive this every other week life-saving enzyme replacement therapy. 2003 ended up being a really good year. And you can start to see the changes with kids and the benefits of this enzyme therapy, a life-saving therapy. And people started to take notice. One of them was a Wall Street Journal reporter, Ida Anand. And he started following the kids' progress, and eventually began writing a story, interviewed dozens of people, discovering what it took to start a small biotech and to make a medicine, especially in a very rare disease. And eventually that led to a front page story in the Wall Street Journal at the end of August 2003. It was pretty neat. I was actually out here on the West Coast, and when they write one of these stories, they don't tell you the day it's going to appear. They give you some indications, but with the journalistic integrity of the Wall Street Journal, of course, they keep it very, very close to the vest. So I got a call from Eileen and said, you need to pick up the Wall Street Journal. It was 7:30 in the morning in New Jersey, 4:30 in California. So I went down to the Wall Street Journal. It's pretty cool. You see the story, and the title of it was For the Sick Kids. And it had my pencil picture, it had Eileen's pencil picture. They tell me I'm the first in my business school class to have his pencil picture on the cover of the Wall Street Journal, and not have been shot at or indicted. So a lot of people read that story. One of them was Harrison Ford. And Harrison called some producer friends of his in Hollywood who had made Aaron Brockovich. They were making the World Trade Center movie. And they said, we should reach out to this family. This might be a story that we need to tell. And eventually, through Harrison championing it and some other folks, the producers, it became a film. And it's become a great vehicle for us in Washington to talk about what it actually takes to develop a drug. We all live in this world where we understand preclinical studies and toxicology and bioreactors and PK studies. The rest of the world doesn't speak our language. And it's been a great vehicle also to show Megan and Patrick as the proxies for millions of people who live with rare genetic diseases and thrive despite their disorder. And then how are the kids today? So, Megan and Patrick weren't supposed to live to be 5 or 6 years old. They're 16 and 17 and a half years old right now. Patrick's a sophomore in high school, Megan a junior. They're still very much affected by their Pompe disease. They're still in wheelchairs, still ventilator dependent, but much more healthy, and they're alive. And it bought us time, not just more than a decade quality of life for them, but a chance for scientists and entrepreneurs like me to go back and try to do it again. I had a breakfast with some of the folks who put on this wonderful conference this morning, and they asked me, how are the kids? And I said, well, it's great. I came out here. We just had Megan in North Carolina with Patrick last weekend. Megan was bridesmaid at her cousin's wedding. And she had been down here a month or so before. She's thinking about college. Megan is an incredibly bright kid, Patrick as well. Pompe never affects the mind. They are amazingly precocious kids. That young girl that you saw who played Megan, they screened over 2,000 young actresses to find somebody with her spirit and her strength and her wise-ass Sicilian attitude. And they found somebody great from Chicago. And they do have a future. And it's because of people in the medical world. And through all of this in this journey, we reflect on a couple of questions I've got. When the movie came out, we had a chance to travel the world and explain what Pompe disease was, our family, and a little bit about drug development biotechnology. And I was in Europe, and I got a question from an Italian reporter, and I'm half Italian by background. And she said, could this have happened here? And I thought about it, and I wanted to say yes. And I said, maybe. I said, but I think in a lot of ways, this is a uniquely American story. And it really gets back to that virtuous circle that's involved in making medicine, where it always starts with somebody in need. And either they or their parents going to somebody who has some knowledge. Usually, they start with these 4 questions. These words, 4 words, we have a problem. And a scientist or a physician on the other side answering with some form of another 4 words, I have an idea. And that starts this virtuous circle, moving from patients and families to patient foundations, almost always starting at its roots in academic research, one of our great strategic advantages in the United States, and a particular strength in the Pacific Northwest. And then from there, moving on to venture capital firms. My company, Amicus, was originally funded in part by money from Frazier Healthcare Investments here in town, who are still a shareholder in Amicus. So having venture capitalists willing to take a chance, angel investors sometimes along the way, small companies, large companies, the NIH, the FDA, the services and supply industry, all of that coming together to help solve that problem. It is a truly unique American industry, one that has increasingly great strengths and roots around the world, and as we become ever more connected. And it's terrific to see at this conference representatives not just from China, but countries in Europe and other places coming to look at the great work being done here in the Pacific Northwest. No doubt going down to San Diego to join the convention in bio and hear about the great work that's going on in biotechnology globally. But this is a very unique industry. We went public. Amicus is the 3rd biotech company I've had the privilege to start and lead. In the spring of 2007, there weren't a lot of IPOs, and we were, at the time, a particularly successful one, and felt pretty good about what we had done. And toward the end of my talk, I'll share with you a story in humility about the IPO. But a couple of weeks afterwards, we had dinner. My wife Eileen had asked, she said, you know, there's a friend of mine who would love to get together. Can we do dinner? I said, sure, always happy to meet new friends. So we went out, and I met her friend a couple of times, and then I met her husband. And eventually it came to, you know, what do you do? I said, oh, well, I work in biotechnology. And it was, I had some understanding. He said that you make medicines. I said, yes, we do. We, at Amicus, we make medicines for people with rare genetic disorders. He said, terrific. He said, and my wife says you just went public. I said, yeah, we're very proud of that. It's a great milestone for an entrepreneur. He said, terrific. He said, what's your symbol? I told him. He said, what's the market cap? I said, well, we're nearly $500 million company. He said, $500 million. He goes, when did you start this? I said, about 2 years ago. He said, unbelievable. He said, how many employees? I said, we've got about 70. He said, $500 million value with 70 employees. I said, yes. He goes, you must be amazingly profitable. And I said, well, no, actually, we're not. We just raised $75 million in capital. We had raised over $100 million from VCs, so we've got a great balance sheet, but we're investing. He said, oh, you don't make a profit. I said, no, we don't. He said, I understand you're building for growth. I said, absolutely. He said, okay, so what are your revenues then? I said, we have one drug in phase 2. I said, oh, no, I'm sorry, we don't have any revenues. Really? So he started becoming concerned about who he's having dinner with. And I said, well, let me step back and explain. So I explained research and the process and what we're doing. And he said, I see. So you're laying the foundation to launch that first drug so that you can generate the revenues and cash flows and reinvest and build a great company. I said, exactly. He said, when do you think you'll have that all done? I said, I have absolutely no idea. And I share that story because it really reflects how most of the rest of the world thinks about business. We're unique in that before we ever get to competition, price, marketing, and all the basic blocking and tackling of building business, we've got to first have the technology that works. And this is a really hard business to find technologies that work. If you think about it, almost everything we do, most of the molecules and devices and compounds that we put into animals and then people in the testing that we do, it doesn't work before we ever get to think about the blocking and tackling the day-to-day issues of business. And so there are a handful of themes that I'd like to carry through the rest of my talk, things that mark this as a very unique industry, all of which are common to other businesses in America and around the world, but acutely here in biotechnology. The first is that vision. You've got to set that vision for what you're going to build. Ours is an industry that's only 37 years old. If you go back to the founding of Genentech, and you think about it, they not only had to advance the technology, they not only had to found a company, they had to put together the foundations for an industry. And it all started in 1976 when Herb Boyer at UC San Francisco had published some academic work around genetic engineering and protein production and the potential for making medicines that apply protein therapies. And then young 29-year-old venture capitalist Bob Swanson at Kleiner Perkins had read some of that work and literally went and knocked on Herb's door, introduced himself and said he'd read some of the papers and would like to learn more. And then they spent hours talking, began outlining the ideas for how you build a business. And from Kleiner and other risk takers investing in that company came the story of Genentech. And sometimes when I have a chance to speak to audiences not in biotechnology, I'll go into a little bit more about what it took to put that company together. I won't do that here. But if you fast forward, there was an interview that Dr. Boyer gave in the late 90s, right after Bob Swanson passed away from brain cancer. And he was reflecting on what it took to build Genentech. We all know the impact that great company has had on people's lives and continues to as part of Roche. But he said something pretty profound. He said when he walked into my office that day in 1976, he changed my life. And when you think about it, he also changed the lives of now millions of people who benefit from the research and development and medicines coming out of a great company like Genentech, but it all went back to that vision for starting a company and starting an industry. Ours is also very uniquely about risk taking. If Genentech and then Amgen and others were the foundations for biotechnology, Genzyme was the foundation for the part of biotech that I work in, and increasingly more and more companies in the field of rare diseases. Genzyme, founded in the early 1980s, and when their then 35-year-old CEO, Henry Tremere, came from Baxter to help grow the company, they had a vision. They were going to focus on rare diseases. They needed to go out and find technologies. Many of us are familiar with the success of Genzyme over the years, and now part of Sanofi continuing to do great things for people in the rare disorders. But it was not an easy road. When you think about the risk-taking that they took, the original drug, Ceridase, an enzyme replacement therapy for Gaucher disease, wasn't made by bioreactors. They hadn't progressed the technology enough to express that complex protein in bioreactors. It began when they licensed a placenta-derived enzyme, so enzyme purified from human placental tissue, as a replacement therapy, and they put it in the clinic in the first study, and in the first handful of patients, where they were seeking to reduce the spleen and change some of the blood markers of this fatal genetic disease. It didn't work. It showed signs in one patient, a young boy named Ryan Berman, whose mom, Robin, was a pediatrician championing this therapy out of the NIH. For a lot of companies, that was well, we persisted and we put it in the clinic and it didn't work, time to go back and try something else. And they did, but they tried something else with that program. And you gotta remember, this was a time where they thought only a couple of hundred people had Gaucher disease. Nobody wanted to work in the rare diseases because they had absolutely no idea how you could build a business making a medicine for just a couple of hundred people. But Henry said then, and he reminded me when I became part of Genzyme years later, that he's not in the business of risk mitigation. They need to take bold risks, and they did that. And he convinced the board to invest more. They still hadn't made a recombinant form of the enzyme, so they still needed to purify it and have a human placenta. And this time they were going to do a larger clinical study, but it had to be a phase 1, 2, 3 combined. And they went to the FDA with that plan. Now, meanwhile, it took 10,000 placentas per patient per year to have enough enzyme. And this was in the late 1980s when HIV was rampant in the blood supply, and they had no way of assuring that wouldn't be in the final drug prep. But this was at the time when the HIV and AIDS community was particularly active in pushing the FDA toward looking at this risk-benefit analysis. And like AIDS, they knew in Gaucher, without taking this risk, there would be nothing else. And so the FDA let it move into the clinic, and they did the next study, and the results were remarkable. In all patients, they showed dramatic reduction in spleen. Eventually, this became as close to a cure for type 1 Gaucher disease for many patients as you would see in the rare diseases, and the drug was approved in 1991 as Ceridase, still made from those placentas. Not until 1994 did we have a recombinant form that was approved as Cerezyme, and that drug continues to treat people with Gaucher disease today. But without Genzyme, without the vision, without the risk-taking, there never would have been a BioMarin, TKT, Shire, and Amicus. Go down the list of now dozens, if not hundreds, of rare disease companies. And it all goes back to that element of risk-taking. We just went through, as a world, a really tough 6 years, and we're still coming out of it. Where the foundations of finance were shaken, and it changed our perspective, maybe for our generation, how we think about risk-taking. With our careers, with our finances. It affected the venture capital world, how they think about risk-taking. That's just, we're seeing signs in the last year or two, and that's starting to change, but ours is a business that has to be based on risk-taking. We will never succeed if we don't take those risks, smart risks whenever we can. But if you're in a position where you think, boy, this is too risky, you really think hard about what it takes to push those technologies forward. And so if we think about vision and risk-taking, the other very, maybe the most important element of how we think about building these businesses is one of persistence. We can point to countless stories in biotechnology of people who kept pushing ideas. One of my great mentors and a board member at Amicus is Saul Barrow, one of the co-founders of Celgene. I'm sure we're all familiar with the story of Celgene. It was founded in the mid-1980s. And the idea that you can actually take thalidomide, a drug was never approved in the United States, approved in Europe, of course, for treatment of nausea associated with pregnancy. But Saul and others had this idea that it could be a very powerful anti-cancer medicine. I had a company offsite at Amicus a few months ago, and like many biotechs, we've been around for about 9 years now, and we've had our roller coaster ride. Thankfully, I'm hopeful that we're on a very strong upswing now. But before we got our phase 3 data in March, and phase 3 in our great program was thankfully successful a month ago, a lot of people were concerned. We had a really tough 2013, some clinical setbacks before that, and I started by showing the stock charts of a number of companies. I showed Gilead, and I showed Orexigen, and Regeneron, and Celgene. You look at Celgene, until they got their drug approved, it took 17 years to get thalidomide approved for multiple myeloma. Many times as a public company, they were within weeks of not meeting payroll. So you think about persistence, what it took to push that forward. We had a board meeting a couple of months ago, about 6 months ago, restructuring and repositioning Amicus, kind of one of those inflection points in the company's history, and I was during a break talking to Saul. And it was kind of bemoaning the fact that, it's been a tough year, the stock got hammered, I've been stuck at $2 or $3 a share for almost a year, and Saul put his arm around me and said, you know what, John, he goes, I was stuck at $2 a share for a decade. And I looked at him and I thought, Saul, I don't know if this is meant to comfort me or prepare me. He said, if you believe in the science and you're honest, keep pushing it as hard as you can. That was a great lesson for me, and the persistence lesson in biotech. In medical research goes on long before this industry was even founded. I don't have a lot of pictures and posters in my office, but I have one that my brother-in-law gave me years ago as a Christmas present. It's a black and white photo. Dr. Jonas Salk in his lab coat with his actual autograph. And a nice description. And you look at the history of what Dr. Salk did in the late 1940s, when polio was the health scourge of society. He originally received a grant from the Infantile Paralysis Foundation, what we now call the March of Dimes, to study the epidemiology of the prevalence of polio in the United States, and eventually grants leading to his work in a vaccine. We all know the history and the success of that vaccine program and the great contributions to human health from his effort, but it was not always easy. I did a little research after I got that frame picture, and it was an interview with Dr. Salk in a magazine, ironically called Wisdom, in the mid-1950s, and he reflected back on what it took to make that vaccine, including a clinical study in 1.5 million school children. Good luck getting that through the agency today. And he reflected on how tough it was, and the author, and I'll paraphrase here, but she said it was one day after a particularly difficult setback in his research. He went to a park and sat on a bench, and he thought about giving up on his research. It wasn't working fast enough. And then he looked around the park at all the children playing, and he realized that many of them, without a vaccine for polio, would become paralyzed one day. And he thought, reflected, and he realized that awesome responsibility that he had. So he got up from that park bench and walked back to his lab. The article said, with their renewed vigor, that's persistence. That's something we have to do every day. The movie, Extraordinary Measures, was actually filmed in the Pacific Northwest. They filmed it mostly in Oregon, a little bit here in Washington State as well. And you may have noticed in that video that was shot in Portland 5 years ago, The kids look different. Megan in particular in that video looked very different. The medicine that we had discovered in Genzyme now markets affected heart greatly, as you saw, but over time, for various reasons, in some children, it doesn't keep up with the muscle strength. And Megan's scoliosis got profoundly severe. I was supposed to be here a year ago and give this keynote talk, and many of you may remember, it was supposed to be, I think, in the second or so week of July. A year ago, this very morning, Megan went into Columbia Medical Center in New York for scoliosis repair surgery, something we've all about for a couple of years. She had over a 100-degree curve of her spine. It was going to be a very risky surgery. It was supposed to be one surgery, but there were complications. And then it was supposed to be two, and then eventually it took 3 surgeries. Some of you may have seen earlier this year a front page story in the Wall Street Journal about Megan and then those surgeries and the agonizing choices that people who are alive today because of the medicines we make but still not cured, the choices that they have to make to extend and enhance their own life. And Megan, when she was 16 years old, made the decision that she would have this surgery. She told us after consulting with doctors, an amazing surgeon, Dr. David Roy, at Columbia, New York, that she didn't like the way she looked and she didn't like the way she felt. And then this after he told her all the potential complications of the surgery, how agonizing and painful it could be, and looked her in the eyes and said there's also a 5 to 10% chance you may not survive the procedure. You know, in that pre-op meeting, my heart sunk. And Megan looked at him and said, without blanching, she said, I understand. And she went through with that. It was, if not the toughest, among the toughest 6 weeks of our lives in that intensive period. And I know you all appreciate and understand why I couldn't be here, because it was supposed to be a 10-day stay, turned into a 6.5-week stay in the intensive period. For as agonizing and brutally difficult as those 3 surgeries were, they were successful. And Megan's left lung is reinflated, and the pressure on her organs is relieved, and she now sits up perfectly straight and tall. And I don't have pictures, but if you get a chance to do them on the website, or Chris, I'll share them, and you can pass them along, and you see the strength and confidence of this young lady. And when we think about Megan, I think about her as just one of countless people who make those agonizing choices. To undergo procedures that we design, clinical studies that we lay out, fraught with incredible risk and sometimes pain, chances of receiving placebo in studies, and that they really are the central actors on stage of our medical innovation. And so what do we provide? We provide hope. When I first started in biotechnology, I left Bristol-Myers at the end of March 2000. And we were going to put that little company together in Novazyme, based out of technologies out of the Oklahoma Health Sciences Center in Oklahoma City, some glycobiology technology, terrific technology, but very, very early. But I didn't go to Oklahoma my first day on the job. I went to bio. It was up in Boston in 2000, and I just wanted to listen and learn to this new industry that I had signed on to. I had just spent about 2.5 years at Bristol-Myers and had become familiar with the pharmaceutical business, but I wanted to know what biotechnology was. As the then 32-year-old CEO of a 4-person company in Oklahoma City with $37,000 in seed capital, nobody wanted to meet with me, and that's okay. I just wanted to kind of sit there and take it all in, and I went to the keynote address that night. And it was given by a man who was a quadriplegic. And he came out on the stage, maybe 5,000 of us or so in the audience, and the stage went bigger than this. And he rolled out in his wheelchair, he was ventilator dependent, and you can see he was a big guy. And you can see, before his tragic accident, the enormous physical strength he must have had, but as he began to talk, you could also sense that inner strength that he had. And he came out, and the first word he said was biotechnology. He said that's a great word that, for people like me, just means hope. He said it's the hope that some of you in the audience are working on cures or treatments for paralysis. It's the hope, too, that it may not be for people like me. Maybe it won't come in time for me, but it gives me that hope. He said, hope that I can hold my wife's hand walking on the beach or throw a ball to my kids again. You give me that hope, he said. He said, but I know again that it may not be in time for me, but it will eventually be in time for somebody. He said, maybe for that kid a year or two from now, who breaks his neck in a football play, and his life has changed, and his family and community's lives have changed, and they're going to go online and begin looking at research. He said the amazing thing is, they're going to look at research years from now that you haven't even yet begun, or ideas that you don't even have. And then when he said that, it kind of struck me. I was very much focused on our kids and the people I met over those couple of years with Pompe disease and other rare disorders. I never thought of the people yet to come. I knew for us, we may not do it in time for Megan and Patrick, but it gave me some hope, us some hope. But it was really striking for me to hear from that man that it would provide hope for people who don't yet know that they need hope. And that's the nature of what we do. Again, much of what we do takes too long, costs too much money, doesn't work. But what we learn, and we push on, and someday, when there is a cure or a treatment, I'm sure it will be in part because of the legacy of that man, Christopher Reed, and in the foundation that he and his wife Dana set out in that work with their foundation. And that's really what hope is all about. It doesn't always have to work today, most often it's not. But it's going to provide that hope to people who don't even know that they need hope today. To succeed in this business, you also have to be honest. I learned this lesson really early on in my career. We put Novazyme together, we got some angel funding, we got a $500,000 investment from a small biotechnology company called Neos Technologies in Bingham, Pennsylvania. And they were interested in our glycobiology technologies and maybe dabbling into rare diseases, and they provided us a $500,000 investment. Another $500,000 would come upon successful proof of concept in animals, something we're all familiar with. Something for me at the time was pretty new, and we were racing. We made a little bit of our enzyme for Pompe, and we had some genetically engineered mice, and we did a small preclinical experiment. We got the results back, and we were pushed up against timelines. Cash was running short. We needed to convince the folks at Neos that we had our proof of concept. And then the data was just all over the place. Looking back on it now, I can almost laugh. And when I first saw it, I'm like, wow, I don't think this works. That doesn't work in animals, it won't work in people. I got to call my boss at Bristol-Myers to get that job back because it didn't work out. And we went out to Pennsylvania and I said, look, we've got to convince them that we've got something here. And there were some nuggets, and then eventually it did work, but those early preclinical studies were far from proof of concept. And we went into a room full of very smart scientists at Neos and presented, and we got our butts kicked. And it was a really difficult meeting. And I went back to our home in Jersey that night thinking, oh my God, what am I going to do? And I got a call the next morning from their COO, Cheryl F., and he said, John, it was a Tuesday morning at that point, he said, what are you doing on Friday? I said, well, Cheryl, after that meeting, I'm not sure I have any plans Friday. And he said, why don't you come down, we'll have lunch. And I thought, boy, it's round two of my butt kicking. And it wasn't. It was a lunch, and he said, Cheryl's a wonderful man, he's got a very good manner about him, and started talking small talk and building businesses. And he shared with me the perspectives of his teammates at Neos on that data. The drug didn't work, the studies weren't executed right, it wasn't the right dose, the assays weren't correct, all the things that could go wrong in a preclinical study did. And then he said to me, he said, John, he goes, we're going to give you a chance to do it again. Take another couple of months. And he left me this lesson. He said, this is an industry. And I'd only been in it maybe 5 or 6 months. He said, this is an industry where people like to polish poop. He didn't say poop. He said, try not to be one of them. He said, companies in this industry fail for only one reason. Not because they get a bad letter from the FDA or a negative preclinical or clinical results. They fail because they run out of money. And executives and entrepreneurs in this industry fail for only one reason. They lose their credibility. is you can't ever lose that credibility. It's okay to say something doesn't work. Most of the times it's not going to work. And that was a lesson real early in my career. And then as we began to build Novazyme, and then in my time at Genzyme, and in Amicus, we tried to build in a very strong patient perspective. And I think about that lesson that afternoon with Cheryl at lunch. But I also think about it as I share clinical data within the confines of our company and then outside to all the constituencies who care. I think about it as if I was talking to my best friend, who's somebody whose child has a rare disease or any serious health condition. And think about what would you tell them? Would you spin it? Would you polish it? No. You can tell them the truth. So it's something we've tried to carry through. In everything we do at Amicus, we have a vice president of patient advocacy, who's one of our first hires. We have our medical advisory board, our science advisory board, but we also, for each disease that we work in, we have a patient advisory board. We don't pay them, but we put them under CDA early on and share with them twice a year very confidential data about our programs, clinical trial designs. And it's made our programs better. It's brought a very intense patient focus to what we do. Never once has any patient in any one of our PABs ever breached that confidentiality. They hold it sacred as any one of our trusted advisors would. And again, it's made our programs better. So be honest with yourself, your team. Tell them, of course it's okay to fail. We're going to fail. When you have a setback, what we try to do is to say, look, this didn't work. Here's what we know. Here's what we don't know. And here's what we're going to do next. I carried that forward in the fall of 2009. We had a phase 2 program in Gaucher disease for pharmacological chaperone at Amicus. A lot of attention to this. And then the phase 2 didn't work. In 18 and 19 patients, we didn't see the clinical changes we needed. It turns out we believe the drug was underdosed, and we didn't exactly understand it at the time, but the data was clear. And we came out with an unambiguous press release describing this. And then the stock got hit, hammered, and the next morning, that afternoon, we have a conference call to explain it. I have the conference call, I lay it all out there, perfectly transparent. And I figured, well, this will get credibility for being forthright. Stock goes down another 25%. So I called one of the analysts, J.P. Morgan, and I said, what's going on? He goes, well, you have to understand, in this industry, nobody ever completely lays it all out there, so they're going to build in a 25% kind of factor. So they figured if that's everything you told them, the real truth must be awful. So there are lessons in how we communicate, and I'll let you decide how best to communicate. But we don't work in an industry anymore that's siloed. Industry information has lots of mediums for getting out there. And it's why you not only have to be honest and accurate, you have to be consistent. And the last lesson I'll leave you with is one of humility. This has been a great year or two for most of biotechnology. Access to new capital, technology succeeding, the FDA beginning to change. Companies going public, who a couple of years ago couldn't even raise venture capital money. It's a really exciting time. And I really believe we're on the cusp of a golden age in medicine. And it's on our shoulders to build the businesses that will make those medicines a reality for lots and lots of people. We went through this in 2007 with Amicus. It was one of these highly touted IPOs, and we had all the best banks on the cover, competing and telling you how great you are until they're not selected for the cover, and then they tell you how great you're not. But you go out and you do the IPO roadshow, and it's exciting, but it's exhausting for those of you who've been down this road. So we travel around for 2 weeks, and they give you one of these big, fancy private planes, and everybody wants to meet with you. And at the end of the day, our book was 8 times oversubscribed. We were raising $75 million at a $300 million pre-money valuation. So we have our board meeting last night of the roadshow in New York. We closed the books. We opened the stock exchange the next day. It was a great day. We watched the stock begin trading on the floor of Morgan Stanley. We go down to NASDAQ. I was on CNBC. We closed the NASDAQ. I bossed the whole company in of whatever it was, 70 or 80 people for a great big party that night. We celebrate. I got the hotel rooms in the city, take a break, and kind of relish the success. And we all knew we could go back to it. I was tired. It's exciting but exhausting. I've been on the road for 2 weeks, and I decided I was going to go home that night. Like many of us who traveled quite a bit for business, I was eager to see the kids. And so I went in and checked on the boys, and my older son, John, was about 12 at the time, Patrick was 8 or 9. And the boys sleep pretty soundly. And I went in and checked on them, and they were fine. And then I went into little Megan's room. She was 10 years old at the time. She's a really light sleeper, and so I gave her a little kiss on the forehead. And she woke up, and she looked at me, her eyes kind of got big. She said, "Daddy." I said, "Megan." She said, "I missed you." I said, "I missed you too." She gave me a big hug. She said, "Dad, how was your big business trip for these couple of weeks?" I had my CEO suit on. I said, "Well, Megan," I said, "we did pretty well. You'd be pretty proud of the old man." She said, "I know, I saw you on TV this morning." I said, "Well, really?" I said, "How did I look?" She's laying there, and just she and I in the room. And she said, "Well, Daddy, you look really, really," and I'm thinking, powerful. She said, "You look really, really kind of short." And then I kind of looked down, and then Megan just got that awkward silence. And then Megan looked up, and then I think I had a yellow tie on, and she said, "But Daddy, that tie really looked nice on TV." So Megan is the master at that damn with faint praise, and so I took that. And then she looked at me and she said, "Are you going to be here in the morning?" I said, "Yeah, I'll be here." She said, "Would you take me to school?" I said, "I'll take you to school." She said, "Okay, good night. I love you." I love you too. And I think in that moment, I realized the ability and success. Believe me, as a biotech entrepreneur, you are humbled many times along this path. But I realized in that moment the ability of success, not because Megan had teased me, that kids tease me all the time. It was because she absolutely, truly did not care about what the VC's IRR was at that point in time, the fancy plane we were in, or the TV shows we were on. What she cared about as a 10-year-old girl was that her daddy had been on a long business trip, and he was home. And he was going to get to take her to school the next day. So I think when we think about humility and we realize, and I've met countless people along this journey too, like many or hopefully all of you, share in that perspective that what we do is incredibly important. And hard work is the price of success. But eventually it comes back to time. And so I'll close with these words. Ida Anand wrote that Wall Street Journal article, went on to write the book, The Cure, that inspired extraordinary measures as well. And over those couple of years, Ida got to spend a lot of time with hundreds of people who were involved in the effort to make medicine for Pompe. And she got to know our kids in particular very, very well. And in her epilogue to the book, she wrote this as her last paragraph, and I'll read it to you because I think it sums up so beautifully well a lot of the themes that I've shared this morning, but particularly the theme of time. And Gita wrote that as human beings, we are defined at our cores by how we respond to hardship. Writing about the Crowleys is talking that there is not one right way, but that each person must find her own path, drawing on her own unique strength, passion, and resources. Who can say whether John's or Eileen's role is more important? Fueled by love, each of their journeys is tough, vital, and courageous. Knowing that each day really may be their children's last, they live with abandon, throwing themselves into every birthday party, trip to Broadway, weekend in Ocean City. Knowing so intimately the tenuousness of life, they understand what most of us forget, that all they really have and all they really are pursuing is time with the people they love. And so they grab onto each precious moment, cherish it, celebrate it, laugh at it, cry in it, and hope for another, even as they continue on the journey into the unknown and the unknowable that we all call life. Thank you, Chris, for this great invitation. It's been wonderful to share some of these thoughts. And good luck for everything you do in biotechnology. It is a tough business, but when it works, it is the best job you can